Yes, it's a good practice to wash the sperm before we use it for fertilization. Once the sperm is delivered in the lab, then and we allow some time for liquefaction. Once it's liquefied, we assess the sperm quality, and according to the sperm quality, we will establish the approach of treatment. In most of the cases nowadays, we load the sperm in an adjusted to the quality characteristic of the sperm density gradient, and the sperm sample is centrifuged for 10 to 20 minutes, again, depending on the quality of the sperm. During the centrifugation, the best quality spermatozoa will swim through the layers of the density towards the bottom layer, and the bottom layer after the centrifugation is washed with a special medium, and the washed spermatozoa will be good for use for insemination in terms of IUI or injection or conventional IVF. However, there are other techniques available, such as swim up, where we try to avoid the excess centrifugation. It's a simpler approach, and it is considered by some colleagues that is it's more mild technique. So it works better for the samples that have high DNA fragmentation index, as it involves the accumulation of the motile spermatozoa in a higher level of sperm medium. And this can be combined with no centrifugation or just one centrifugation step. However, today there is an increasing number of new tools that may use the raw sample instead of washing the sample, and through some kind of filters that mimic the natural environment of the womb and tubes, will create a gradient of the sperm with the best of them accumulating in a certain well. This is the new approaches where they try to mimic the natural environment and try to create the best possible conditions for selecting the best spermatozoa for fertilization. So it seems that after a period of constant use of density gradient and swim up approaches, it seems that a new era is arising where we will eventually increase our sperm selection techniques and hence our performance of our IVF and ICSI approaches.